Hello, everyone. Good morning, good afternoon from wherever you are joining us from. My name is Dr. Tashina Reeder, and I am excited that you decided to take some time out with us today to participate in today's webinar. But before we get started, I would like to share with you a few notes to remember as you engage in today's webinar. The chat box has been disabled. However, you can ask all of your questions in the Q&A box below. Any questions that you may have will be answered at the end of the webinar. And as we begin to wrap up the webinar at the end, don't log off. You will be prompted to complete a survey because we want to hear from you. We want to hear your feedback and hear all of your thoughts about today's presentation. So when we end the webinar, you will be prompted to complete that survey. So don't log off, okay? Without further ado, I'm going to hand over this presentation to our presenters.
Thank you. Good morning, everyone. Let me just go ahead and share my screen here. Hopefully I can do it. All right. Great. 1 second. Okay, so good morning. My name is Kelsey Piedra, and I will let the rest of the folks here introduce themselves, but we just want to thank you so much for being here in this space with us. Thank you to Philly Fight and everyone at the Community Health Training Alliance for hosting this event and giving us this platform to share some of our information with you. And I'll allow Marnay and Jasmine to introduce themselves.
Thank you, Kelsey. Good morning. I'm Dr. Marnay Castillo. I'm the Clinical and Research Director for the Adolescent Initiative, the program where I get to work with Kelsey and Jasmine, and I'm really excited to be here this morning. Thank you.
My name is Jasmine Pierre-Lewis, and I'm the Routine and Screening Nurse Coordinator here at CHOP, and I'll also get to work with these lovely ladies.
Okay. So today we are very excited to talk to you a bit about our COVID-focused work at the Philadelphia Juvenile Justice Services Center. And we'll explain more about what that center is and what our work looks like. But we just wanted to kind of give you an overview of what we're going to be talking about today. So we'll spend a little bit of time talking about the background of the PJJSC. We'll talk a little bit about procedural considerations for HIV testing and COVID testing programs, and then we'll close out by just sharing some of the lessons that we've learned and some of the takeaways from the work that we've done. And so our goals for today's webinar are really to allow space for folks to learn about effective strategies for implementing COVID testing programs in detention settings, to identify linkage of care opportunities for youth who are involved in the juvenile justice system, to reference a framework for doing cross-systems collaboration work, and doing so in order to address the barriers to care and reduce health disparities for these youth. And then finally, we want to just recognize and highlight some examples of how HIV programming can be expanded to meet community health needs, especially in light of the current pandemic. So that's a little bit about what we're going to be talking about today. And without any further ado, I'll hand it over to Marnay, who's going to really introduce AI and some of the work we do.
Thanks, Kelsey. Just wanted to provide everyone here an overview of the Adolescent Initiative. Some of you may know us, some of you may not. The Adolescent Initiative is a program within the Adolescent Medicine Division at the Children's Hospital of Philadelphia. And our focus is really on HIV care and HIV prevention, although we do expand to other areas that impact adolescents. We have three arms of programming. So we do the clinical care for youth living with HIV. We also have a PrEP clinic within our HIV clinic that we began maybe about 3 years ago. We have a very robust research arm where we also get to collaborate with public and have public health partnerships. So we do a lot of collaboration with different community partners around research. We have several advisory boards, including a really vibrant youth community advisory board. And our research portfolio is quite varied. We are part of the Adolescent Trials Network, which is a national network that focuses on HIV research for adolescents. But we also have some other R01s, as well as other research grant awards that are doing a variety of different types of research and with other partners as well. So we have a pretty diverse research portfolio. And then we also are making sure that we're trying to expand to do HIV prevention and care work in the community. And as such, we recently acquired a mobile health unit, which we'll be launching this week, so that we can take some of our, not only just our programming, but our research and some education into the community, and also encourage folks to access care. So we are an outpatient specialty care clinic. We see over 100 adolescents and young adults. Our age range is 12 to 24. We have clinical care, medical case management, and our model, it really is a medical case management model that is really the focus of for folks when they first come in, as we link them and get them accustomed to doing clinical care around their HIV. And we also have a navigator who will work with our youth in the HIV PrEP clinic. We have this important program, which is also a very unique program nationally in the PJJSC, which started over 20 years ago, where we began working with DHS and ACO to go into the PJJSC to provide risk reduction as well as HIV testing. And again, Kelsey and Jasmine will tell you more about that. We serve Philadelphia and the surrounding counties. We try to provide one-stop shopping for our youth. So we have a multidisciplinary approach where there's physicians, nurse practitioners, social workers. We have a wellness counselor. Folks can participate in research. And we also have services for incarcerated youth within the facility, and then also when they leave. Again, we have a youth community advisory board that meets every month, and also ad hoc to provide us information and feedback about how we are perceived in the community, research opportunities, where we should go with our programming, and also our community partnerships and outreach as much as possible. And we're hoping to be able to get back out there into the field very, very soon, actually starting today, to be able to continue to do those community partnerships where we can do some capacity building, but also as well as be able to identify gaps and move forward as far as being able to decrease HIV acquisition among adolescents.
Thank you so much, Marnay. So I'm going to give a little bit of background information on what the Philadelphia Juvenile Justice Services Center is and how it operates. I know that probably many folks joining us have at least heard of it or have some understanding of it, but we also know that a lot of people may be joining us from, other counties, other states, so we wanted to really give that background information. You'll hear us call it the PJJSC or the JJSC. There's many acronyms, they're all a mouthful. But what it is the only juvenile detention center that serves the city of Philadelphia. It's run by the Department of Human Services, which operates as kind of the centralized child welfare agency for the city. It's located at 48th and Haverford in West Philly, and it was formerly located downtown and called the Youth Study Center. So this new location and this new facility was opened around the end of, I believe, 2012, and they expanded kind of what the space that they had to offer, but also kind of what they were able to provide in-house. And so you'll see, like, within this building, there's a school that's operated by the School District of Philadelphia. There's medical services and a medical area on site, along with other things as well. So it operates as a short-term residential detention facility for youth ages about 13 to 20, and it has over 150 beds, accommodates nearly 5,000 youth a year, and typically it's meant to be exactly like it said, a holding facility. So it's not meant to be a long-term housing or residential program. Typically, youth will stay there on average between 6 to 10 days, but those numbers can really, really fluctuate depending on an individual youth and what it is that they're going through in terms of their legal situation, and if they have any child welfare involvement. So we'll see youth that may be only there for a couple days to youth who are there for much longer periods, like a month to several months, either awaiting placement or awaiting some sort of disposition on their case. So youth are held here at request of the courts while they're waiting for their cases to be heard and waiting for some sort of disposition around placement. And so different avenues that can happen are youth can be released home to their families and their caregivers. Sometimes youth are released under community supervision. So that can look like a child advocate or GPS monitoring, so like an ankle bracelet. And then oftentimes youth are also sent to residential placements, either in state or out of state. So there's a number of different kind of pathways through the system for youth, but we know that there's a number of factors that influence how long someone will stay. And, unfortunately, we tend to see the kids with more complex cases who are there for the longer periods of time. So our services at the JJSC, which Marnie started to kind of highlight, were really developed in 2001 when DHS noticed that there was an excess of young folks at the center who were at high risk for HIV. And so DHS partnered with the Adolescent Initiative to try to implement programming that would help target these youth. And this was really based on the success of our medical case management model for youth who are living with HIV. So we're able to kind of adapt those services and make them applicable to youth who are, having juvenile justice and child welfare involvement and being housed at the JJSC. So really at the heart of the work that we do is around providing intensive sexuality education, case management, advocacy for youth, helping to support all of the kind of psychosocial factors that we know impact an individual's health and individuals' sexual decision making, and especially geared towards adolescents with real focus on being trauma informed and acknowledging the role of systemic injustices and disparities that impact the youth that we work with. So primarily our program will work with the youth who are identified to be at the highest risk for STI and HIV. And so that oftentimes will be young men who have sex with men, LGBTQ youth, trans and gender expansive youth, and as well as the young women who are at the center. So like I already kind of touched on, our program really provides one-on-one case management services, one-on-one education, and with the goal of prevention, but also, linking folks to medical care and services that they need in the community. So whether that's primary care services, whether that's STI and HIV testing, therapy and mental health care, benefits, housing, whatever it is, it's very much tailored to what the individual needs. And we really try to provide ongoing care that is reflective of adolescent development. So making it super low barrier in terms of, what youth need to do to be able to access services and allowing them to kind of flow in and out, and always just making sure that we're kind of like a safe and stable place for them to return to when they need support. So that's really at the heart of what we do. And like Marnie said, we will serve youth up until age 24 years old and then help to kind of transition them to adult care and services. So some of the things that we think about in terms of HIV risk for young folks, especially young folks in juvenile detention, really center around some of these kind of risk factors or risk behaviors. But we know that HIV rates are disproportionately high for young Black and African American youth, especially young Black men who have sex with men and transgender youth who have sex with men. So that is like part of the reason why the program exists the way that it does in the JJSC. But we also recognize that in Philadelphia, STI rates among youth are higher than they are nationally. That Philadelphia is ranked 3rd highest in the nation for STI prevalence. We also know that incarcerated youth have higher rates of STIs than their peers. And that they tend to report multiple sexual partners, earlier age of sexual intercourse, inconsistent condom use. But we also know that there's a number of factors that influence an individual's health outcomes beyond just individual decision making. And for the youth that we work with at the PJJSC, and across the board for youth who are involved in these systems, we know that there's higher rates of trauma, there's higher rates of ACEs for these youth, and that there's a number of systemic factors that are really stacked against them in being able to access the resources that they need. And so, part of our work is really focused on the individual, but also acknowledging that there are larger systemic issues that we are also trying to work up against, and in order to help support young folks to have the best possible outcomes in terms of just not what we deem to be important in regards to STI and HIV risk reduction, but really aligned with what their goals are for themselves, because that's the most important thing. And so a number of the young folks that we work with have reported, things such as history of homelessness and transience. Many of them have been through the system before and are very familiar with being at multiple residential placements, so have kind of some of those disruptions in their healthcare just based on being moved around a lot. History of engaging in survival sex in order to meet basic needs and things like that. So we really try to be mindful of those things in the services that we provide to young folks. And that's a big part of the reason why the HIV prevention work that's been implemented at the center has been so important. So we'll talk a little bit about what that actually looks like in terms of HIV testing at the center, which has kind of shifted course over time. So initially, HIV testing was not offered universally to all youth at the JJSC due to just kind of limited resources. So currently, and this is something that has occurred over the past year, which has been a really, really huge and like monumental achievement, is that the PJJSC has been able to implement universal routine HIV testing for all youth who come in, meaning that a youth will come into the center and as part of their medical intake, they're offered HIV testing. And so it's kind of like an opt-out model in which everyone, regardless of who they are, will be offered testing, and then they can decide whether or not it's something that they want for themselves. So here we just kind of wanted to show a little bit of what that flow looks like and how we've been involved with that work. So like I said, when a youth is admitted to the PJJSC, they'll be offered testing. Currently, they're doing the INSTI test. So testing is only reflective of preliminary results. So if a youth is identified as a preliminary positive, they would be immediately linked to care to be able to receive confirmatory testing. And then at that point to have immediate med start, immediate linkage to social work and to medical providers. And if a youth has a place in mind that they would like to go, the JJSC will accommodate for them to receive services wherever they would like to be. But we also are kind of able to offer that built-in referral stream so that youth can receive services at our clinic and then decide where they'd like to receive care. So with that being said, so if a youth is identified as being HIV positive, at the center, they will be immediately linked to medical services and immediately receive social work and counseling support. If a youth is identified as being HIV negative, they can be referred for HIV prevention and PrEP services. So we do a lot of work with helping the medical staff at the PJJSC to be aware of what these services look like and know how to refer youth to us in order to be able to connect them with what they need at that point. So we do a lot of work with the PJJSC to be able to transport youth who are there to one of our outpatient sites at CHOP where we have HIV prevention and PrEP clinic so that youth can engage in those services even before they're released from detention so that they've already established a relationship with the clinic and with the providers and so that there's continuity of care across their transition into wherever they go next. And then lastly, if a youth declines HIV testing, they're referred to the social work team at the JJSC for testing counseling to see kind of what's going on in terms of their apprehensions around testing, see if there's ways to kind of provide support and provide information so that should they decide they want to in the future, they are empowered to do that. So this is the model that we've really been able to help support and help the JJSC operationalize in terms of the work that they're doing and provide training around how to deliver a positive result, how to counsel around HIV testing. And through this, when the need came for COVID testing at the center, we were really able to look at, okay, what are we doing here and how do we adapt this to meet the need? So before I get into all of that, kind of just want to touch on, COVID and how it's impacted youth, specifically incarcerated youth. So on the right side here, you'll see a chart that is from the Sentencing Project, which was tracking the number of COVID-19 diagnoses in juvenile facilities across the country. So this data is as of February 22nd, 2021. And you'll see here in this little arrow pointing to our lovely state of Pennsylvania that we are kind of falling here in the middle in terms of, case prevalence, which is still, it's not great. It's not the worst, but it is still alarming in terms of how this is impacting youth who are systems involved, who have very little autonomy over how they're able to take COVID precautions, how they're able to support the people in their lives who may be at risk for COVID, and how they're able to kind of take care of themselves. And so we just really wanted to highlight this quote from the American Academy of Pediatrics because we felt that it really kind of highlighted why this work is important and why we felt compelled to really fill this need in terms of testing. So It says, similar to the disproportionate impact of COVID-19 among historically disenfranchised communities, disparities within the juvenile justice system are rooted in inequalities in the social and environmental determinants of health and the failure of public policies to adequately address them. As the world grapples with how to respond to the COVID-19 pandemic, the needs and rights of justice-involved youth must be fulfilled. Now, we're at a place with COVID where we're seeing a decrease in the number of cases, we're seeing things open back up, a return to a sense of normalcy. But I think that this quote still really holds true because we are still in the midst of the pandemic, even though, things are opening and vaccines are becoming more widely available. The pandemic hasn't gone away, and it's still very much a reality, especially for youth who are involved in the juvenile justice system. And we want to acknowledge that and to honor that this is really something that's still impacting a lot of people and in very, very real ways. So, as it's probably sadly not a surprise to many folks, there are huge disparities in terms of racial demographics of who is incarcerated and what youth are being incarcerated. So we see the highest incarceration rates among Black youth. And this information here comes from a survey conducted by the Annie E. Casey Foundation, in which they surveyed, I believe, over 150 jurisdictions and about 30 states nationwide on a monthly basis to collect information to be able to report real time what's happening among detained youth in regards to COVID. And what they found was initially in the beginning of the pandemic, there was a push to decarcerate. There was a push to remove youth from detention facilities to ensure public safety, to really get people into spaces where they could safely socially distance, where they could take the precautions that they need to prevent the spread of COVID, but also, in terms of, it really highlighted how many youth are in detention and why are they there, and do they even really need to be there? And so as we're grappling with this massive wide-scale public health crisis, there's also it's further highlighting the disparities that already exist and really shining a light on those. So the initial push to get youth out of these facilities kind of happened steadily, and we saw numbers go down. And then, over the course of time, they kind of start to creep back up. And we see this in the data, and we've seen this kind of anecdotally in Philadelphia as well. And the number of Black youth who are being incarcerated continues to be disproportionately high. And what this chart here is showing is that Black youth are staying in detention for longer periods of time than their white youth counterparts, and also that they're being incarcerated continuously at a higher rate. So we know that this particularly impacts Black and Latino youth, and we want to really frame this conversation within the context of talking about racial justice and talking about racism as a social determinant of health. And then, so just to talk about further disparities during COVID, we know that in Pennsylvania, Black and African American youth are 7 times more likely than white youth to be incarcerated, which is a really jarring number. And like I mentioned, some of this research and survey found that Black youth are staying in detention longer than their white peers, and this is the biggest gap that they've seen since the pandemic began, and that the population of Black and Latino youth continue to grow while the population of white youth continues to go down. So I highlighted this last point here because it seemed like a point in which the data was kind of inconsistent with what we've seen in Philadelphia. So it says admissions to detention remain low, almost 50% lower than the pre-pandemic level. And while that might be the case among the jurisdictions that they sampled, that doesn't seem to be the case in Philadelphia. Currently, the census at the PJJSC is around 130 to 140 youth, which is pretty consistent with numbers pre-pandemic. And that number does always tend to fluctuate, but we're not seeing that youth are, being released into alternative settings because of the pandemic and staying there. We're seeing that, for whatever reason, youth are continuing to be detained at the PJJSC. And so just wanted to kind of acknowledge that and to point out that this particular to Philadelphia, there are still a number of youth in juvenile detention. And that's part of why this work is really important in terms of not just COVID, but in terms of talking about youth incarceration, period. All right, and so we know that cases of COVID in juvenile detention are being underreported. There's not a centralized mechanism for collecting this data, and if there is, it's not being made transparent to the public. So information from the Sentencing Project says that as of March 31st, there's been almost 4,000 cases of COVID-19 identified in youth correction facilities. And that number means a lot of things, but I think what's really important is the reality of what this means for youth who are being held in detention. And so we know that specific to Philadelphia, but also across the data and literature that is out there about this, that there's significantly increased isolation. And the isolation is in part because that's just how youth incarceration operates, right? Youth are separated from their families and separated from their community supports. But that's further exacerbated by youth being held during a pandemic in which in-person visitations are suspended. So family members can't come visit. Outside programming has often been suspended during COVID. So, access to education and social services and programming that would really help support youth during this time are not made available. So we see longer periods of time of youth, being held in quarantine when they're initially brought into detention. So youth are being held in quarantine currently for 7 days, which is better than it was before testing was available, which was a period of about 14 days. But we also know that quarantine effectively functions similar to what you would imagine solitary confinement, in that it's not punitive, but that youth are being held in isolation to prevent the spread of COVID. And we know that that does, even for short periods of time, have detrimental effects on mental health and a number of other things. And we also see that there's a backlog created in the juvenile justice system in terms of youth being able to move out into community settings or into placements and residential treatment programs. And then that there's a lack of resources to prevent the spread of COVID-19 within these facilities, especially in the early stages of the pandemic. And then just to really highlight kind of what we've heard from some of the youth that we've talked to about this is that it's creating an environment that is highly stressful, and it's creating an environment in which youth who are already feel incredibly powerless in their situations are feeling even more so. And it's also, creating additional burdens on families and on youth being able to maintain and sustain meaningful contact during their periods of being in detention. So just to kind of dig in a little bit to how this COVID testing program started and why it was so important, just want to give a little bit of background. So the Juvenile Justice Services Center in the early days of the pandemic realized that they couldn't move youth safely out of the facility into community-based programs and residential treatment facilities without knowing the COVID status of that youth. This is something that outside programs were requesting, and were saying that youth couldn't be admitted without a negative COVID test. But at the same time, the PJJSC did not have the capacity to test youth for COVID-19. They didn't have the capacity and they didn't have the testing resources. So they were stuck in this bottleneck situation where they had youth continuing to be admitted, but they weren't able to move youth out, and youth were experiencing longer stays in detention, just as a fact of not being able to access a COVID-19 test. And then of course, there's also the concern among staff and administration there that, you know, there could be a potential outbreak of COVID from between staff, between youth who are residents at the center. And so there was a very clear need for testing and an immediate need for testing. And so we were approached by the PJJSC to see if there was anything that we could do to kind of help support them in the interim, even temporarily. And because we were already working with them in an HIV testing capacity and an HIV prevention services capacity, and this was kind of a natural extension and was really aligned with the work that we do. So we were able to kind of step up to fill that need. And the testing program at the PJJSC began on, I believe, May 20th or 21st of 2020. So it's been over a year now that we've been able to provide this service. So just to kind of break it down a little bit, the first step was really identifying the need and identifying the gaps in services. So we were able to sit down and talk about, like, why is this important, and how do we address this, and how do we address this in a way that's reflective of how time sensitive this is. So they required additional resources, and we were able to kind of take that and look at, what do we currently have available? So how do we leverage the existing resources that we have to be able to implement a program as quickly and as seamlessly as possible? And so that required us to engage with stakeholders both within our hospital system and within the city and DHS to see how this could happen. And so we had a shared kind of understanding of what are our mutual goals for getting this done, especially around public health and safety, but also around reducing the burden of COVID-19 for youth in juvenile detention. And as part of kind of leveraging our existing resources, CHOP was able to offer from our supply chain testing kits to the PJJSC, in which the PJJSC could collect the specimens using the testing kits we provided and then return them to us so that they could be processed through our lab. And we were able to really develop this system under the leadership of our medical director, kind of bringing this up the chain to the folks who needed to make these decisions within the hospital. And, of course, it was very much aligned with the work that we were already doing. So, we were really able to make a case for being able to offer this collaboration. Another big component of how this was able to work is the fact that the PJJSC has on-site medical providers. So we were working with a system that already had healthcare within it, and we were able to utilize them to implement this program. So the healthcare providers at the PJJSC are operated through Horizon, which is a correctional healthcare provider. Some of you may be familiar, they also provide healthcare services within the county jail system up on State Road. So they have, you know, staff who required little training in terms of being able to do the testing and to properly store and transport and everything like that. And then we were able to establish protocols for implementation. So because we're two systems working kind of together and in tandem, of course, we had to develop our own internal processes for how registration would operate, how, you know, how we would communicate results to the PJJSC, how contact tracing would be established, and really to delineate roles and responsibilities around that. They were also able to reassign staff to support this program. So, you know, just full transparency. So my role as the HIV prevention case manager in the PJJSC was, you know, which shifted during COVID as I wasn't able to be physically present in the center. And so looking at kind of how I was able to help support some of this because I wasn't able to be there in person, and looking at staff-based resources for who can kind of do this and how do we make it happen. And then just kind of actively troubleshooting as barriers arose and as we saw, you know, things that needed to kind of be wrinkles that needed to be smoothed out in terms of the testing program. So just, you know, to give a little bit of a picture of how this started and how all of this operated. And then I'm going to turn it over to Jasmine, who's going to walk through the day-to-day process.
So we wanted to give you guys an idea of some of the routine that we implement with the team as a team with PJJSC. So the youth who are held at the request of the courts, they arrive at the PJJSC. And then from there, the medical department completes their intake and completes the COVID screening and initial testing. From there, the samples are then dropped off and they receive an email and they create a list. Every morning, we receive an email from PJJSC designated coordinator of a list of the new admissions for that scheduled day with the group number listed along with like the patient identifying information, such as the name, date of birth, and insurance information. The CHOP COVID task force, they register the patient and like create a chart in our electronic medical record base, which is called EPIC. And then from there that we're able to see the results on our end. So afterwards we sign on to EPIC and retrieve the results for each patient on the list. And based on the results, we kind of see our approach on how we're going to notify the PJJSC. So with as far as negative resultings, when we do like when we see a negative result, we follow this process. It's very similar to positive, just a little bit different. We first start out by documenting negative on the patient list. And then afterwards, we use like a template letter that is served as the official notification of the COVID-19 testing results. This letter is dated and addressed to the PJJSC and includes like the patient name and date of birth. It also includes like information such as the collection date and the date of the final review results for by CHOP. Once the template is completed by us, we save it as a PDF and then we send it to the PJJSC team. And then lastly, we create like a progress note in our electronic medical record where we basically explain and document the notification of results to the PJJSC. Now, as for the positive results, it's very similar in the process, but it's just a few differences in how we notify them. We definitely document the positive result on the patient list, but then afterwards, we immediately notify the PJJSC of the positive results so that they can take the necessary precautions and protocols. Once that happens, PJJSC takes full responsibility of notifying those involved in the care, such as their legal guardians or family. We also refer them to our Greater CHOP hotline for resources and additional guidance. And then from there, internally, PJJSC initiates their internal protocol based on the guidelines. Afterwards, we use a similar but different template that is served as official notification of the COVID-19 testing results. This template is dated and addressed to the PJJSC and includes the patient name and date of birth. It also includes such as like the negative template, the collection date and the date of final review of the results by CHOP. And then we also include the CHOP guideline recommendations that is in accordance with the CDC guidelines, along with the number for the Greater Philadelphia Coronavirus Hotline. Once this template is completed and is sent as a PDF, it's sent to the PJS team. And then lastly, we do the same thing as negative. We document in our EPIC database and explain that we have notified the PJJSC. So as far as our goal was to provide a need in services to help the youth at the PJJSC during the pandemic, we were able to establish a successful outcomes such as avoiding widespread transmission or outbreaks to date. We established a protocol with PJJSC for testing, isolation, and contact tracing. We minimized the length of time you've spent in quarantine as a PJJSC, which is truly important, as mentioned before, due to the pandemic causing a backlog in the youth system. We created a pathway for the youth to move safely out the PJJSC facility, and where some were able to transition to placements that required a negative testing. And then lastly, we are still able to continue to provide tests to youth till this day. Some considerations to our day-to-day process. One of them is repeated testing. Upon quarantine, the youth also repeats their tests in 7 days. As far as early notifications, sometimes the PJJSC may request to receive results from one person prior to receiving like all of the results, because it does take a while to complete the templates and complete all the results. So sometimes they may reach out to us and ask for one particular person. We also do make accommodations where some PRS may have scheduled meetings or appointments. So those patients who are identified, they receive priority notification. For Saturday resulting, during the weekdays, the positive and negative results are reported the same with the exception of Saturday. As far as the positive results, we immediately call the nursing triage at PJJFC and inform them of that one of the patients or a few, whoever is on the list that comes up positive, we just let them know. Whereas on weekdays, we usually send them via email. As far as our CHOP COVID task force, as a partnership, we are in daily communication with the CHOP COVID task force regarding registration and insurance verification, and just resulting questions and et cetera. We do have a good communication where sometimes they'll let us know that all patients have been registered, and if they see any issues, they also reach out to both us and PJJSC. And then lastly, meeting needs. We have the flexibility to add additional youth. Sometimes they may send a list and a youth may last minute agree to take the test or get submitted at a later date. We do have flexibility to add the additional youth. And then as well as those who have no insurance, we're still able to provide testing for them, regardless if they have insurance or not. So we were able to do that as well. So this bar graph is a survey by the NEEKC Foundation. This graph focuses on the COVID-19 cases in youth detention facilities with staff and cases also listed. As you can see, December and January saw the highest prevalence to date of COVID-19 cases among both youth and staff in detention centers. The case counts had dropped on the day that the agencies completed the February survey, but with jurisdiction reporting 116 active cases among youth and 221 active cases among staff. With this next graph is more so focuses on PJJFC's COVID-19 test results. As of May 31st of 2021, we had administered 2,565 tests, and of those, only 68 came up positive, which is really good. This bar just demonstrates the number of tests administered each month and those that came up positive. As you can see, there's a large spike in administration of tests around September and October. Although we don't know like the exact reason for these spikes, several factors can be considered, such as internal factors. They may have been experiencing like increased emissions during this time, or like external factors such as like COVID guidelines from CDC, and as well as how quickly those are getting discharged as well. And then numbers remain low in terms of positive cases, but every month we were still seeing positive results, which shows the need for this program because we were able to at least catch those at an early time who came up positive. This also shows the positive results identified at the PJJSC. We did start testing in May of 2020. The case positivity rates were low compared to national average, but we did notice a spike around November, which is apparent. Again, the several factors can be considered, such as like the Philadelphia restrictions and guidelines that we had in place, as well as like internal factors, admissions and discharges, and just also theories that, you know, around this time, as far as like the December, January area, like flu season was approaching, and as well as like schools were opening and closing. So it's several factors that could play part on why that positive results were like such a high spike around November.
And the holidays too.
Yeah, definitely holidays. As far as discussion part, when implementing the service for PJJSC, we identified several factors that significantly impacted our COVID-19 testing program with PJJSC. As for issues with notification, we resulted 6 days a week, Monday through Saturday. We did not report any results on Sunday. So as a result, we didn't receive the next results. PJJSC didn't receive the next results until Monday. So it did cause 1 day for them to probably remain isolated due to not knowing the results until that following Monday. As for positive results notification, as mentioned before, we did have to notify via phone for the nursing triage on Saturday because due to scheduling, no one would have seen a positive result if we sent it via email on Saturday. So we did have to make the proper steps to directly notify them of the positive results that may have appeared on Saturday. As far as discharge admits, some admissions were discharged prior to receiving notification of the results, but PJJSC did take initiative to complete contact tracing. Oftentimes, we experience issues with the samples. Some samples may have leaked or incorrect identification issues, such as misspelled names, first and last name sometimes were swapped, or incorrect date of birth. We briefly may have been short on supplies, but we were able to work on that. And then these issues, you know, cause us to not receive any results sometimes, or some youth may have to be like retested again due to these issues, such as like if the samples were leaked. So we did have some of those issues, but we were able to retest and get those youth their results. Sometimes multiple charts may be created for youth, especially those who may have received care at CHOP or CHOP networks in the past. This can cause difficulty looking for the youth to view the results, as sometimes the results only appear on one chart, but not the other, or sometimes we couldn't find the duplicate chart. So we were able to contact the COVID task force, who were able to let us know that where to find it, or if we could find the results. And then from them, we will let them know that a particular person had a duplicate chart where they were able to merge the chart and merge all the information from both charts. We found that this program ran smoothly with having a point person with PJJSC during the program. This allows for like clear expectations and keep the program more organized. We were able to add additional staff to help with running this program as well. Our partnership with PJJSC remained intact for continued linkage to care for the youth to receive HIV and STI services. This program was able to pivot and integrate all of our resources towards the COVID-19 so that we can still establish a partnership with them and still help them, those who may need those services as well. As far as the guidelines, as CHOP and CDC updated their changing guidelines, we continue to provide that information as it did change throughout the pandemic frequently. So we were able to let them know and then of the resources and the guidance and let them use it to their discretion. As far as like barriers to policy implementation, in congregate settings, we understand that it's difficult to follow the guidelines that were placed in the CDC. Like, given the close proximity that defines, you know, the congregate settings, it might be difficult to implement social distancing and pose as challenges to prevent the spread of COVID-19. And then also working with youth may be difficult as some may not want to remain in compliance with the protocols or guidelines, such as wearing masks or social distancing and being like socially isolated if they came up positive. And which makes sense because, you know, some of the youth in the system rarely have family to rely on as a healthy support network to help guide them. Some of them may be filled with like risk and trauma, characterized by like drugs, sexual exploitation, violence, living on the streets, and just family breakdown. So sometimes they have difficulty trusting adults, and we may be telling them like, you gotta wear a mask, you know, you gotta socially distance yourself. So it makes sense why someone may be resistant to some of the guidelines that were placed. And as a result, it could be difficult for the professionals to engage them and to convince them to get tested, because some would decline testing and would every day they would ask until they, you know, eventually would agree. So it makes sense why it was hard to engage with them, some of them, or, you know, why it was slow to change and frequently challenge, you know, the protocols. But eventually they were able to get some of them to get tested. If it was not that day, but the next day or the following day, we would notice those who have refused would pop up on the list. And then lastly, as far as HIPAA compliance, this is an important piece due to constant communication regarding the use information with various people such as the PJJSC staff and then as well as CHOP staff. Careful considerations were made, and those requests to be added to communication had to be approved from a designated PJJSC staff. Without approval, they were not able to receive notification or weren't able to get anything from us. We did have in the past, someone did try to, I guess, get information in the loop. So we continue to remain in compliance with HIPAA and to further reach out to PJJSC to clarify and make sure that everybody within this chain of command and chain of communication was able to receive the information with all the youth's private information.
Thanks, Jasmine. So just to wrap us up here, I wanted to just talk briefly about some future considerations and really kind of how this work can be transferable to other folks who are, you know, HIV service providers, other folks who work in juvenile justice settings. And really we want to highlight that there is a need for continued efforts to divert youth from the PJJSC and other juvenile justice congregate care settings, not just as a matter of like COVID-19 public health initiatives, but also just in terms of, you know, understanding that these systems can oftentimes be really damaging to youth. And as much as we want to ensure the health and safety of youth while they are in these systems, and that is, you know, always a pillar that is incredibly important for us to uphold, we recognize that these systems are in need of change, and that pandemic or not, we need to be thinking about what are alternatives. How do we invest in education? How do we invest in community care? How do we invest in prevention services that allow youth to thrive and to stay in their communities? And so, you know, in light of COVID, we really want to highlight that, you know, there's a need for testing efforts to continue, both COVID-19 efforts, but also continued routine HIV screening, especially for youth who may not have regular access to healthcare or who may not have had HIV screening before. Oftentimes when youth come into contact with these systems, it is an opportunity for there to be a point of, you know, medical intervention or testing being offered and things like that. So while these systems do exist, we want to make sure that, you know, they're operating in such a way where youth are getting access to services, and also continued programming to expand routine testing to help educate, you know, individuals within systems, but also adolescents about the importance of testing. And there's, you know, many linkages that can be drawn between HIV and COVID, and in terms of you know, pandemic response, but also in terms of prevention and how to ensure public and community safety. So continuing those conversations, and you know, other considerations are for the development of a COVID-19 vaccine program for justice impacted youth. So currently, you know, the PJJSC is considering and trying to develop a way to make vaccine available to youth. But as far as we know, that hasn't really been able to be fully formed just yet. There are a number of barriers to that. So thinking through vaccine availability, accessibility, and how do we get youth who we know are going to be particularly impacted by juvenile justice and being more likely to end up in congregate care settings to have access to vaccines should they want it. And then just thinking about why is the information around COVID testing within these facilities kind of so hard to come across, and you know, we want to encourage transparency around testing data, both on a statewide and national levels. And it's part of the reason why we wanted to share, you know, our testing data that we have with the community, because we think that it's important. And you know, it's important to both know when there's you know, like relatively low case positivity rates, but also to know where there's increased risk for you know, widespread COVID outbreaks. And so we see that there's transparency around testing data for many more adult correctional facilities, but less so for youth. And then lastly, just trying to emphasize that there's always a need for research and services to address the impacts of COVID-19 on incarcerated youth, especially for those youth that hold marginalized identities, and you know, that they continue to be a population of kids that are particularly vulnerable. And we want to just highlight that it's, you know, there's so much work to be done, and this is just one tiny piece of it. But hopefully there are some things here that will be helpful in terms of thinking about how, you know, how everyone here can be plugged into supporting the needs of justice involved youth in some capacity, whether that's advocacy, whether that's service provision, whether that's just sharing this information with someone that, you know, you talk to in your life. And with that, I think we can open it up for questions or comments, discussion, and thank you.
Thank you so much for your presentation. Trying to get myself adjusted. Hello again, guys. Thank you so much for your presentation. It was very informative. For those of you watching, if you have any questions, please feel free to post your questions in the Q&A below, and we will answer them accordingly. So we do have a question. Okay, this is Early in the presentation, when providing data specific to Blacks, is there a reason why African Americans were referred to separately from Blacks? For example, Blacks and African Americans. Are African Americans not Black? Are health disparities in youth incarceration only experienced by African Americans in the Black community? Why the distinction? Do you think this distinction perpetuates inequities in the Black community? Overall, very informative presentation.
Yeah, I can answer that question. I think that, because I think it was when I was speaking. So the language that I used, I was Black and African American youth, and not to create a distinction, but just to use inclusive language, and that not all, youth who are Black identify as African American. There's, Black Latinx youth. There are, that there's multiple identities that kind of fall within different categories that we have for identifying race. So just to be inclusive of folks who may have different like migratory journeys, and may come from, different places and may not identify as being African American, but identify as Black. And that certainly I do feel that the data that we had access to is limited in terms of looking at racial demographics, doesn't break down in terms of ethnicity, and really just kind of looked at Black, Latinx, and white youth. And so we don't have information, for example, on Asian American youth, or anyone else kind of from that holds different identities other than the information that we had available to us. So I think that's a really important point to highlight, that, this is just one component of looking at identity and how that impacts youth in terms of incarceration rates, and how there is so many other factors, and there's a need for there to be kind of more specific information that doesn't just kind of lump people into really broad categories, because we know that people have different experiences, and we want to see that reflected, and be able to honor that and really show the nuance of that. So I do appreciate that comment, and I think that that's why I chose to use the language that I did, but that it wasn't, the data wasn't making a distinction between Black youth and African American youth, but that was just a way of being inclusive in the language that was being used.
Thank you. The next question, how are youth quarantined at the center when some months there were over 20 positive cases?
So the case count at the JJSC for positive COVID tests never exceeded 20 cases. That may have been the data that was showing kind of national case positivity rates. So off the top of my head, I don't know what the highest number of positive cases has been in a month. I would have to go back and look at that. But typically, the case positivity at the JJSC has been really low, which has allowed them to be able to quarantine youth. But if they were to have an outbreak or a surge in positive cases, it would be really problematic, because they wouldn't have the space or the capacity to be able to quarantine everybody. So that's a big concern, and that's part of the reason why the testing was so necessary, to be able to identify and contain cases that came up.
Okay, thank you. The next question is, can you email slides? Are you providing slides? Can people oftentimes ask for slides because the presentation is so awesome. Can they have access to those? So if you have a modified version you could share, you can always give it to me, and Kyle and I can distribute to all those who are in attendance to today's presentation.
Yeah, absolutely.
Okay. The next question is, are there additional ways you'd like to expand the Adolescent Initiative in the future? Fantastic presentation. Thank you so much for all of your work.
I will let Marnay answer this one.
I'm wondering, so the Adolescent Initiative in general, I really want to keep this specific to this program. And we were always trying to, just like I think all of the community agencies, trying to expand our reach with youth. Right now, we're going to be focusing on our community-based outreach and education, as I mentioned, going back into the community, in part using a mobile health unit. I think within the PJJSC, I think we're hoping to, this whole project was a huge expansion. I mean, Kelsey and Jasmine, I think, were two of the hardest working people during the pandemic in the past year, because they were trying to maintain the existing program, and then completely creating an additional one that was based on COVID, in an area that we had some infrastructure to build off of, but was also a completely different kind of situation and different kind of infection that we had to deal with. And as you saw, Monday through Saturday, it was really pretty intense. But I think we are committed to working with the PJJSC to roll out vaccine work, if that's a direction they want to go into. I think that's a direction we would like to go into, as Kelsey mentioned. I think that COVID screening, I don't think COVID is going away anytime soon. So if there's a way for us to just continue to enhance and evaluate what's happening in the PJJSC to make it better, it's been a huge push and rush, and we've been impacted greatly by what the CDC brings to us and looking at what the system is itself. And so I think some of our plans are, now that we've had an opportunity to present this today and really dive into what the details are around all the different steps that we took, to be able to look at that and evaluate it, and then to improve it for the future. So I hope that answers your question.
Thank you. The next question, did PJJSC experience any deaths of youth due to COVID?
Fortunately, no. Not that were reported to us or that we're aware of. So, you know, I hope that that is the case. But as far as we know, there have not been any youth who have been lost to COVID, and we feel like very, very fortunate and very grateful that that's been the case.
Okay. Thank you for your answers to the questions that came through the Q&A box. If there are any, or if there's other questions, please feel free to post them in the Q&A box. In the meantime, do you have any last words you would like to say to the audience in relation to your presentation?
No, just thank you everyone for being here, and thank you so much for your questions and your participation.
Great. We have one question that just popped in. Any attempts to vaccinate?
Yeah, so as Marnay was saying, there's been some kind of preliminary discussion around vaccine availability for youth at the PJJSC, but they have a number of their own internal factors that I think they have to work through in terms of, you know, guardian consent for things like that. And so while they're trying to work through some of those things, I think we're also looking at the capacity that we have on our end to help support that if that's something that they're able to do. But part of the work that we're doing too is to educate all of the youth who we serve through AI and in the community about the COVID-19 vaccine, and to provide education around around the vaccine to dispel any myths or misconceptions, but also to help people access it if they're interested and want to. So hopefully that can be expanded to youth at the PJJSC in the future, and we'll continue to partner with them on that if that's something that they're able to offer.
Thank you. This is an informative presentation. Again, thank you so much for taking the time out to share your experience and knowledge regarding this topic matter. Okay, we have some questions coming in. That was, okay, it's like a blink of an eye here. Or the next question, these terms, divert youth, impacted youth, marginalized identities, sounds like flowery terms for data collection. Non-whites clearly make up the majority of the population. Can you share one case of a person reported positive, received your treatment, and is doing well?
So some of the youth who were identified as COVID positive were asymptomatic. So I think that was oftentimes the case. We did have a few youth who came to CHOP and were identified through the emergency department for non-COVID related medical needs. But as far as we know, that the PJJSC has been able to provide like the medical support for youth within the facility. So we haven't really been involved as much in the COVID-19 related care or treatment because that hasn't really been necessary. But there, many like of the youth who were identified as COVID positive have been able to move from being in isolation to being in like the general area on the units with other youth, and then have been able to move through the system and to go, onto whatever their next steps are in terms of like going back home with their families or going to some type of program. So, that is kind of how it's been so far. And luckily, we haven't seen any youth have really acute medical needs because of testing positive for COVID.
Okay. Thank you.
Mm-hmm.
There's another, sounds like there's someone who likes what you all are doing over at PJJC and is wondering if you guys are expanding your program via hiring new employees to support your work.
I can take it, Kelsey, unless you. So wouldn't that be great? So this is this is just thinking back in time, right? Many of us had to do this pivot to focus on COVID. A lot of resources, I think, were diverted in general over the past year in order to address COVID-19. So fortunately, we had Kelsey and Jasmine who were able to do that in some cases because some of the other work wasn't coming up, or we weren't having the same numbers necessarily to focus on for some of the other work that we were doing. This is a completely grant-funded project that we received from DHS, so we would need to consider and seek out additional funds. There aren't existing funds right now in order to expand this program. And again, the medical support that we received within the hospital was just our medical director just diverting and making sure that our systems within CHOP were able to absorb some of these additional tests that we were able to run and working within EPIC, as Kelsey described. So it remains to be seen how much more is going to need to be done. And I think that overall, probably citywide, we're going to have to think about what's happening around COVID testing and what the different agencies are going to be able to do and their capacity in order to be able to continue the work that they did in response to COVID and now bring back the work that we did originally. So it's a really great question that I say, yes, I would like to look into expanding this program. Do we have a concrete plan? Not yet.
Thank you, Dr. Moran, for that response. Any other questions? If not, I want to thank you all again for your time and sharing on this topic matter. For those of you who are watching, please do not log off, but hang on tight. You'll be prompted to complete a survey at the end of this presentation, okay? Again, thank you all for presenting today. If there isn't anything else, we're going to end today's presentation. Everyone have a great day. Bye-bye.
Thank you.
Thank you.